Okay, Commissioner, you are set to go.
Well, good afternoon, everybody. It's Tuesday, May 19th. My name is Shawn O'Grady. I am the president of the Board of the Franklin County Commissioners. Today, I'm bringing a conversation that I think could be very helpful to many of us, coping with the stresses of COVID-19. As with previous segments of Commissioners' Conversations, we will provide you information and tips that we think will help many of us get through this ordeal. We have a lot of resources to share at Franklin County, so we'll make sure that we are copying a lot of this information and putting it on Facebook, on the Facebook thread as we are going along. Of course, if we don't post something that you want to know about, just ask us. We'll try to get, we'll do our best to try to get the information to you. There's no denying that this has been a difficult couple of months. And unfortunately, we do not yet see an end in sight. So as a reminder, Ohio's first coronavirus case was discovered on March 9th. We now have more than we now have 28,952 cases. And in Ohio, we've had 1,720 deaths. In Franklin County, we've had 4,706 cases. And as of today, we've had 193 deaths. There are currently 599 individuals in the hospital. So meanwhile, at the same time we're dealing with this public health outbreak, we are also dealing with a financial struggle. And so the experts believe that nationwide unemployment is somewhere between 15 and 20%. Today we have with us three guests. We have with us Dr. Kevin Dixon, who's the Vice President of Community and Cultural Engagement for the Alcohol, Drug Addiction, and Mental Health Board of Franklin County, which is also commonly called ADAMH. We have with us Mr. Shawn Holt, who is the CEO of Maryhaven, and we have Miss Julie Erwin Rinaldi, who is the CEO of Syntero. So as always, please feel free to put your questions in the comment field here on Facebook. My staff will relay them to me as we will try to get all of them answered. We've structured these sessions so that we have a lot of useful information and resources. So feel free to share on your own page as well. There's a lot of people that are struggling right now, and we want to see what we can do to be of some help. So let's get started. First, I'd like to start, as I often do, by having my guests explain a little bit more about who they are and what their agency does. So, Dr. Dixon, let's start with you. If you could tell us a little bit about yourself and a little bit about ADAMH.
Thank you, Commissioner O'Grady, and thank you for bringing us all together. As you know, these are very, very challenging times for all of us, and we're having an opportunity to be able to share with our ADAMH partners that we are responsible for the planning, funding, and evaluation of mental health and addiction services here for the county. ADAMH partners with more than 30 nonprofit organizations to provide mental health and substance use disorder services here in the county. All of these provider staff work tirelessly to help people who are often at their most vulnerable times. And I want to publicly thank them for their important work that they are doing in our community, especially during these times. I'm lucky to be joined by two esteemed and venerable CEOs from a couple of our provider agencies today, and look forward to having them share information about what they do, and their agencies provide the services to our Franklin County residents and our system of care. Thanks to all of our provider agencies for offering services to this community. ADAMH is where better begins, and 80% of ADAMH funding comes from a local property tax. And we are really gracious and appreciative to our listeners today, because if it wasn't for them, for their ongoing support, we would not be able to provide those services that we offer our community.
Well, thank you. I appreciate that, Dr. Dixon. Mr. Holt, a lot of folks have heard the name Maryhaven for years. but they may not know exactly what Maryhaven does or what it's all about. Can you give us a couple of minutes about yourself and about what Maryhaven's all about?
Sure. Thank you, Commissioner. My name's Shawn Holt. I have the great honor of being President and CEO of Maryhaven. We've been in Central Ohio since 1965. We strive every day to bring hope, innovation, and compassion to individuals who are struggling with mental health and addiction disorders. We operate 4 campuses in Columbus, including our main treatment center and detoxification program at Alum Creek, our engagement center for homeless individuals, our women's residence, which is a unique program where children actually get to spend and live with their parents while their mother is in treatment. It's an outstanding program that we are lucky to have. And most recently, our Addiction Stabilization Center on South High. We serve patients also in Union, Delaware, Morrow, and Marion and Crawford counties. Our goal is to provide comprehensive services for patients of all stages of recovery, including medically assisted treatment. We work closely with this 12-step program and other peer-to-peer recovery groups, as they can be critical to long-care success for most of our patients in recovery.
Great. Well, and so thank you for that. And Ms. Rinaldi, can you tell us about yourself and about Syntero now?
Sure. So Syntero is an organization where that works both in Franklin County, Delaware, and Morrow counties, but we also serve folks from the surrounding counties as well. We are a nonprofit organization that provides behavioral health care, both treatment and prevention. And so behavioral health is mental health and substance abuse treatment and prevention. In Franklin County, we have been serving Franklin County residents for 42 years. So we're a little younger than Maryhaven, but we all work very closely together, actually. So it feels like we've been doing this a long time, but obviously not as long as you guys have. We are in 4 school districts in Franklin County. We're providing suicide prevention programming and substance abuse prevention in those school districts. So Dublin, Hilliard, Upper Arlington, and Grandview Heights. We're also at Tolles Technical School, which is a feeder for a lot of the Franklin County schools. And so that's one of the largest investments that the Franklin County ADAMH board makes, is in the school-based prevention services that we provide. And then we have 3 outpatient sites. So we have a clinic out in Northeast Ohio off of Agler Road. Or Northeast Columbus, sorry about that. And we have one in Dublin and Hilliard. And we have been a contractor of the ADAMH board for probably over 30 years. So we have been embedded in the organization and collaborating with a lot of different organizations for many years. So I'm glad to be here, and thank you for picking this topic today.
Well, we're glad to do it. One of the reasons that I was so interested in doing this show is that, well, there were several reasons, but it's been estimated that about 1 in 5 people in the United States has mental illness. It's estimated before the outbreak. I don't think that I need to remind anybody that these last 2 months have been unbelievably tough, and that those numbers may have changed just in the last couple of months. I'm sure my guests have had a clear picture of how this outbreak has been affecting all of us. My wife, who's sitting across from me, we could tell you, just here in this house over the last couple of months, that's, the stress, things have, been difficult to deal with here. So we can see it here. Are you guys seeing any increases or more requests for help over the last couple of months? And we can go around, but let's start with Dr. Dixon.
Sure. During this time, just to give some resources, Netcare Access has expanded their crisis services to offer emotional support to anyone who is struggling. The number there, so you'll know, is 614-276-CARE or 614-276-2273 to talk to a licensed Netcare Access counselor who can provide emotional support and direct you to helpful resources. It is so critical because during this time, we're hearing more and more individuals are struggling and need to talk to someone about their challenges that they're having. But we really couldn't be more proud of our providers and their staff who are working tirelessly to support the mental health and addiction needs of our community. ADAMH mental health and addiction treatment providers are open and have remained open from the first day of this pandemic. So we are still conducting business, may not be the traditional come to the brick and mortar to the facility to see services. Some are, but the majority of them are doing it remotely and virtually. So it's worked out very well. So we know how difficult this time is, and it's impacting us all. It's impacting me, trying to be home with two others that I'm not used to seeing all the time. You know, working from home is very stressful, but at the same time, we know how critical these services are. So I was going to ask both of my colleagues to be able to share a little bit about some of the things that they're seeing, but we're definitely seeing some increases, particularly those who haven't received services before are coming and asking for help.
So Shawn, at Maryhaven, what about overdoses? You know, the number of
Yeah.
cases went up in recent years, but what about during the outbreak?
Yeah, we've definitely seen an increase in, unfortunately, in overdoses. COVID-19 has created a heightened state of stress and anxiety, as you can imagine, which unfortunately is a perfect scenario for relapse. Individuals are tending to use in isolation and often do not have help with them in the case of an accidental overdose. More importantly, because they're also in isolation and maybe they don't have someone beside them that could administer naloxone to them. That's why I wanted to take this time out really quickly to remind everyone that's listening to this that you can request a naloxone kit through the mail with Columbus Public Health if you're a Franklin County resident during this COVID-19 pandemic. You can access this resource by contacting columbus.gov/CFCAP. I think that's critically important to have that on hand, especially if you know that you have friends or family members who may be suffering from substance use disorder.
Repeat that again, Shawn, if you would.
It is columbus.gov/CFCAP.
So that and that site and the one that Kevin mentioned earlier, the NetCare number, those will all be scrolling on Facebook as we speak. So Julie, at Syntero, what about kids? Are you noticing anything with them? Are they less likely, maybe, or less inclined to ask for help? Are you noticing anything different with them?
Well, we've definitely seen an uptick in stress levels up for all populations. And so with children being at home, being disconnected from their friends and their teachers and their familiar settings in school, with, as you described, multiple people in the family at home trying to work or go to school and are out of daycare. I mean, there's definitely the stress levels have gone up. And so we have really tried to reach out using different kinds of mechanisms to get the word out. So we've been creating a lot of social media posts and videos and different things with our staff to get out. And the ADAMH board's been really great in getting those out to folks. We've been collaborating with the school districts to get that messaging out to parents, to young people. We've done some special videos and education for students who missed out on graduations this year and are maybe missing out on prom. Also parents who are struggling with, trying to parent, trying to teach, trying to do everything they need to do, and in a maybe more chaotic environment. Children aren't going to just come up and go up to you and say, I need help, typically. They're going to say things like, my tummy hurts, or my back hurts, or no, I don't want to eat tonight. Or, they might start crying for no reason at all, different ages. Little ones may start to, wet the bed again when they haven't for a year. There's just a lot of ways that they might be demonstrating their stressor and their anxiety. And one of the things we want to tell parents is, please know that they are watching everything you're doing. They're watching your reaction to how this pandemic is impacting you. And even though they may not look like they're paying attention to you because they're playing with their blocks or they're in their room reading a book or playing video games, they're paying attention to what their parents and caregivers are doing and how we're responding to this pandemic.
No question about that. We've noticed that around here, that's for sure. Well, I'll give you two small bits of advice. Junior high age kids, TikTok. And the other thing I would tell everybody out there, not just you, Julie, but everybody out there, this class of 2020, they don't really care about your high school picture from 20 years ago. They don't really care at all. Everybody threw up their high school graduation picture from 20 years ago, and this class of 2020 does not care.
They'll
But
figure that out someday, but right now it's pretty important to them.
exactly right.
I would tell you, Commissioner, don't download TikTok. It's highly addicting. I've done it.
My daughter would love for me to have TikTok. That's my wife's world. She's all good on doing the social media with my kids. I have Facebook. I have a couple of the other ones, but I don't do them. I don't do Snapchat. I have Snapchat, but I don't do it. The kids do that. My wife does that stuff. I don't do that stuff. But, so anyway, well, we all worry right now, but isn't stress normal? I mean, don't we all get stress? Isn't stress just a normal thing? But I mean, I was having this conversation with my doctor yesterday. I mean, isn't stress a normal thing that we're all dealing with? Kevin,
Yeah,
go ahead.
sure. No. Well, yeah, stress is normal. And while stress is normal, what we worry about is prolonged stress that can negatively affect us mentally and physically. ADAMH's medical director, Dr. Delaney Smith, offers some tips for managing stress in long-term crisis, which are available on our website, www.adamhfranklin.org, and will be linked in the comments section on this live session. Some of her tips include maintaining a routine. That's so critical. And I tell my daughter, who's a little bit, she's in her 20s, but I say, get a routine every day, even though you're home from, you're finishing up your graduate program, get into a routine. Just don't do nothing since you're waiting on this final project. Getting outside. And I often hear Commissioner O'Grady sharing that information when we were having our county call. He said, it's a wonderful day out here, get outside and, spend a little time. And literally, I did do that, Commissioner, one afternoon around noon. I jumped on my Cannondale bike and did a couple of circles around the block, but it felt so much better to feel the sun and get out. I felt much more relaxed coming back into the home environment. And then incorporating exercise into your daily routine, even if it's just taking a few steps around the block or going up and down some steps, move. It's so important to keep moving during these times because that stress can be reduced. And you look at, how you regulate your body, playing a musical instrument. If you have some drums or congas around or something to do that's repetitive, it really helps to settle the brain. We also want to ensure that stress that individuals should also consider associated with this is limiting substance use. That's really critical. We hear so much on the news talking about the increase in the purchases of alcohol. And we have to make sure that we're very mindful in reducing the amount of substances we take to deal with the stress. Drugs and alcohol will leave you feeling more anxious and depressed in the long run and can lead to medical problems that will make you more susceptible to infection. So, find opportunities just to get out, sit outside. There's a lot of things going on outside. Yesterday, I opened my front door just to look out, and there was never saw a mallard in my life on my front stoop sitting there. And as I think the more we're inside and the more that we are sheltered in, the more the animals are reclaiming their space. So that being said, I'll go ahead and kick it back to you, Commissioner.
So first of all, let me jump in here to remind folks to send in their questions to Facebook. I want to make sure that I'm taking time to do that here so that people are understanding that they need to get busy doing that. In a recent article, the clinical director at the Ohio State University Wexner Medical Center said something worth quoting here. He said, if we focus on taking care of one another and we focus less on what's being taken from us, we'll cope with this much better. Well, that sounds like some good advice. Do you guys all agree with that? Does helping others actually help us? For example, social distancing doesn't mean total isolation, checking in on one another. So does he have something there?
I can jump in on that. I mean, I think anytime any human being can reach out to another human being and, help somebody, volunteer, especially, children who can reach out to people of different generations, that's good for your mental health. So it's good for all of our mental health. So if we are extra stressed right now, thinking about ways that we can reach out to others, just simple ways like sending a note to somebody, like in the mail, the real mail, or just sending an email to check in on somebody, asking if you can buy groceries for your next door neighbor. I mean, just anything that we can teach our young people to kind of distract them from this about let's go and help somebody else. Let's go help another human being. And it can be very simple things that we do. But yes, I agree. I think everyone would agree. Anytime you can reach out and help someone else is good for your mental health.
Julie, I would just piggyback on what you say, that we're in the helping profession every day. I think sometimes we forget about that. I think this pandemic has reminded us that we need to be better people across the board. And I'm sure everybody on this call and everybody who's listening feels a whole lot better to help others than to receive sometimes. I'll tell you, it feels really, really good to help people.
Yeah. And staying emotionally connected is always important for our mental health, especially while we are social distancing. We can help ourselves and others by reaching out to check on one another, as others have indicated, text, call, video chat with friends and family on a regular basis to keep those emotional connections strong and maintain a good support network. I use the quote proverb from an Egyptian spiritualist that says, doing good is not difficult. In fact, just speaking good is a monument for one who does it, for those who do good for others are at the same time doing it for themselves.
Well, he's a doctor for a reason, that's for sure. Dr. Dixon right there. Well, a couple of things on that note is we teach our kids to try to do those type of things on a regular basis, whether it's cutting the next door neighbor's lawn for her, or they went over and did some gardening work for their aunt and uncle not long ago, and they do that stuff without expectation of some sort of reward, and just because we've been trying to teach them that stuff their whole lives, and they've finally gotten to a point where they just go do it kind of out of the kindness of their hearts, and they enjoy doing it now, where before it was always a chore. Now the older they've gotten, the more they actually go and enjoy doing it just because they do. The other thing that I found early on in this pandemic, I was encouraged to make some community calls. We call them, reach out to people just for the sake of reaching out to them, because this it's crazy time and people didn't know what to make of all of this, and so I started making some phone calls in the afternoons when I had some time, just to reach out to people, and I was encouraged to do it, so I did it. And when I was first doing it, I thought, man, I got all this stuff going on. I'm going crazy. I got 52 different Zoom calls and conference calls and all this stuff going on. I don't have time for this. And as soon as I started making these phone calls, they were met with such a positive reaction from the person on the other end of the phone. It filled me up inside with such a great feeling. People couldn't believe that I was taking the time to call them. And I mean, to be honest with you, I was doing it because I was being encouraged to make the call. But then, if it made me feel so good to call these people, I couldn't stop doing it. And so for weeks on end, I kept making these phone calls because of how good it was making me feel. And everybody else on the other end of the phone call was thanking me for how good I was making them feel. I felt terrible because I was doing it in such a selfish way. But it was a positive mental health thing for me and for them. And so I've continued to do these things because, both selfishly and in a way that, it's just a great thing. Just pick up the phone and call somebody and say, how are you doing? How's your family? Is everybody healthy? Are all your loved ones healthy and safe? And how are you doing and how are you handling this? And that's all I was doing. I wasn't asking for anything. I just was checking in on people, and I was making 6 or 8 or 9 phone calls a day. And it was the best 2 hours of my afternoon every single day, both for the people I was calling and for myself. And so there's a recommendation for the rest of you. Here's some, so we got a suggestion or a question from a caller. Can you tell people who speak other languages how they can access your services? So if each of you maybe can speak to that, how can folks who speak other languages access your services?
Shawn, you want me to start?
Go ahead, Julie.
Oh, Julia.
So we actually on our Syntero website, there's a Google process where you can go and pick different languages. So you can do that, and then we work
Can you give
with
your website, Julie?
Sorry.
Can you give us your website? Sorry.
Oh, it's www.syntero.org. So it's syntero.org. You can go on our website and you can actually pick different languages so that it'll pop up in the different languages. So all of the content will change into the language that you need it to change into.
Great.
And then we work with a number of different organizations that do interpretation skills for different languages. So we work with just about anybody that needs interpretation and services. So please give us a call. We're open and available to anybody who needs us, whether you speak English or not. So.
Yeah.
Right.
Same with us, Julie. Our website is maryhaven.com. Us is 614-445-8131. We provide any type of language that you speak. We'll make sure that we get an interpreter for you. We are fortunate to live in a county. Not just saying this because the commissioners on this call, that we're a helping society in a community. And we help all people. And, you know, I know we're going to talk about this later, but don't worry about insurance either. If you're a Franklin County resident and you don't have insurance, still give us a call. Still contact us by our website, email us. We'll make sure that you get the services that you need. And that's because, you know, like I said earlier, we are a very helping community and we're blessed to live in Columbus, Ohio.
That is true.
And this is, the language services are offered at all of our provider agencies. And then we have some organizations that specialize in working with certain communities. For example, Buckeye Ranch focuses working with the Somali community. They have support groups, they do outreach, they do engagement with those particular communities. And then also we have Columbus Public Health, and they provide services for the Latino community. They have a Latino women's support group, which reaches out and works with women who don't speak English, and they provide resources there. And then North Community Counseling Service, they support and focus on the Bhutanese Nepali community. So all of those organizations have specialties, but each one of our providers work with a variety of the population, the international immigrant and refugee populations that are here in Central Ohio, which were quite diverse and bring a richness to the society. So we're able to pivot, we're able to work with them, and we have some resources that are translated into different languages.
And if you go to, we're scrolling all this stuff through the Facebook page. If you, for all of that information, that should be there. There's also always the commissioners.franklincountyohio.gov/COVID-19 site. If you can't find your language anywhere else, you go to that site, we will find an interpreter for you. Because we are Franklin County and that's what we do. So I should mention that May is Mental Health Awareness Month, and a statistic that I can share that my staff came across during their research and our research for all of this. A recent survey showed that about half the population is feeling mildly, moderately, or severely depressed during this time. That's 1 out of every 2 people. Of course, depression is something that isn't always evident. You can't necessarily tell by looking at someone that they're depressed. What are the signs that you should notice or pay attention to that prompt us to reach out and offer someone help? And do those signs indicate varying degrees of depression? How do we notice this? How do we understand when somebody's depressed? Kevin?
Sure. There are many warning signs that a person should be aware of when folks are not doing well. And those signs and symptoms are very critical. And those individuals may benefit from reaching out to our warm line or hotline for support, which we mentioned and shared earlier and on the scroll. Some of the warning signs that you should be on the lookout for include insomnia, poor concentration, irritability, increased substance use, change in energy. And that can mean a lot of things. You know, you're not doing the same kinds of things that you were doing before. You don't have the interest that you did. You may be isolated. Also, crying, an inability to enjoy things. Those are the signs that you need to look out when someone is, experiencing some depression. And if you see these that go more than a couple of weeks, then, the concern is there. And just to let you know, we do offer what we call mental health first aid training. And out of that mental health first aid training under the auspices of Mental Health America, they do a wonderful job with helping people to identify signs and symptoms that we should be on the lookout for. And it's really designed for the layperson. But since we're in COVID right now, they're trying to work with the National Council on Behavioral Health to be able to pivot to an online version. But usually this is done within a 6 to 8 hour session and is free of charge, offered to all Franklin County residents. But we will be sharing that information once it's up again during this COVID crisis to allow individuals for free to take these classes to be able to notice the signs and symptoms. And as you'll also see posted on the Franklin County scroll, information about the hotline and warm line, information about NetCare access, nationwide children's behavioral health services, Franklin County Suicide Prevention Hotline, St. Vincent's Center, Warm Line, the Peer Center, and other organizations that are offering services at this time. So I'm going to let some of my clinical staff here share some of the work that they're doing to address depression and anxiety as we go through these challenging times.
So Shawn, do these signs vary? Do they vary at all for folks that are living with substance abuse disorder?
Unfortunately not. They're very similar. For somebody who's suffering from substance abuse disorder, I would just add that isolation, change in sleeping habits, not telling the truth, most importantly, a change in friends. And if you start to see things in your home being stolen or come up missing, I think those would be some significant warning signs that you have to look out for.
And Julie, it's sometimes really hard to tell with teenagers or kids who go through hormone swings or mood swings anyway. Do the signs differ in teenagers or children?
I think that there's a lot of similarities, but I think there's nuances. And so when you're looking at sleeping pattern changes, appetite changes, mood changes, physical changes, complaints about stomach aches, back aches, headaches, that kind of thing. I think just parents and caregivers and other, adults around the child need to really be hyper vigilant right now to watch for just any changes in a child's behavior, no matter what the age. And I think also I'd like to just make sure folks know that if you have a family history of depression or substance abuse, that is definitely something to be aware of, that if there's a history there, to really be cognizant of the fact that your child might have a propensity towards depression or substance abuse, and to kind of keep that in mind and take it seriously. The other thing is just if your child or your family is going through any additional conflict right now, like if there's a divorce taking place or a separation, We want to make sure that there's any additional stressors on top of the pandemic that are going on, that you pay definite attention to what is going on with each one of your children. And they may not be saying it to you directly, but they may be saying it to you indirectly, that they're struggling.
Gotcha. What are some tips for handling and managing stress right now? Are there different coping mechanisms that you can recommend?
You know, it's step away from media. It seems like a Sisyphean task to do because we're so technology driven and focused, but finding time to get away from that, including social media, getting constant updates increases your stress levels. So instead, set a specific time each day when you allow yourself to read updates and check for reliable sources, but don't spend all day because it's very addictive. You can pull you in and you can really get stuck in that space, and it can really create anxiety with respect to what's going on, to hearing all the data that comes out and it changes every 5 minutes. And I use this. I said, the more high tech, the more high touch we need. So I try to govern myself to try to balance that, but it is a challenging time to be able to step away because we're so used to doing it every day, with whether it's the phone, whether it's the computer, whether it's the television. We look for instant information, and those sources can provide that. So
what am I going to do, Kevin? It's my
job. Or at least have a schedule. So I'm going to look at this time frame, and like you said, Commissioner, get out and take a walk. If you have, 15 minutes would help immensely.
You know what? The reason that I give those bits of advice to everybody every morning is, honest to God, I learned early on because of this, because of social media, because of the news media, because of the constant updates, because of everything I learned early on in this thing. I have to do exactly what I'm telling everybody else to do, because early on I learned this stuff was getting to me, and I noticed that it was getting to other people. I noticed it wasn't just me. It was not just getting to me. It was getting to other people because of the high stress and the high level, because it was for me in my position and for those of us in my position. And it's not just my colleagues, Marilyn and Kevin, but my colleagues across the state and across the country who we talk to on a daily basis. I noticed that it was getting to all of us. And so I had to do those things. I had to do just exactly the things I tell you guys about every day when I'm on those calls. Yeah. I had to change my perspective. I had to go for a drive. I had to go to a metro park. I had to go, walk around the block, or, get out of the house, go run some errand, do whatever. I had to do those things I was telling all of you guys to do, because I spend my day on my phone, on my, getting updates, reading CNN, watching CNN, listening to the governor, talking to county commissioners across the state, across the country, on conference call after conference call after conference call after conference call after conference call. And so because that's my life, I had to do exactly that. So what you're talking, I apologize. I shouldn't have interrupted you. Keep telling people what to do, because you were so right. Sorry.
Take oxygen first. I was going to ask Mr. Holt and Ms. Rinaldi to go ahead and share some of their tips.
Yeah, no doubt.
Julie, I would just tell you, we had to step up our game as well. We know that addiction is not a disease that affects individuals through Monday through Friday from 9 to 5. So we've had to offer weekend support groups. We've had to offer support groups at night. We have had to change. We have a saying at Maryhaven that we need to meet folks where they are. That's very, very important. Gone are the days where you're just open from 8 to 12 and you expect people to.
We lost him there for a second. Shawn, you still out? We lost Shawn for a second. Julie, you want to step in?
Sure. So I think, I can kind of tag on to what Shawn was saying. all the organizations in the ADAMH network of care and beyond are really trying to look at different ways to really reach out to the public, people of all ages, both little folks to adults to older adults, trying to get creative in how do we reach out to folks and to provide that ongoing education on how do you manage through this pandemic, and how do you keep your emotional health and your physical health at an optimal level during this time. And it's tough. It takes an effort, and it's kind of simple things. It's eating right, exercising, like getting outside, connecting with folks in a different way, whether it's through Zoom calls or just calling on the phone, but just taking a break from that news saturation that you just talked about, and just trying to take a break from that and find ways to connect with other humans in a different way. It's and also looking at how are we introducing trauma in other ways to our lives. What TV shows are we watching? What movies are we watching? Are we watching things that are re-traumatizing ourselves during a very traumatic time? Not a good idea. So if you're thinking about the kind of things that you're watching on TV or scrolling on Netflix or any of that, or even on your phone, think about how you're re-traumatizing yourself over and over and over again. Even if it's not the news, it might be something very negative that's not good for your brain, not good for your psyche. And so just really thinking about those toxic ways that we're reintroducing trauma in our lives over and over again. Not a good idea ever, but certainly not a good idea now.
So I think Shawn has jumped off to try to jump back on because he was having a little bit of a computer issue there. In the meantime, before we switch to the next topic, I wanted to come back to when I was talking about the all of the media stuff, and as you mentioned with kids, a lot of times because both my wife and I would have so many of these calls and Zoom meetings and conference calls, and then there's all this inundation around here, and we have 4 kids here and so much going on. A lot of times I will take those calls and take them outside, get them out of, go into the front yard, go into the backyard, weather permitting. Obviously the last couple of days the weather's not been permitting, but take those calls so that the kids aren't as inundated with all of that stuff. They don't need to hear, constantly be bombarded with all of the type of stuff that I have to deal with on a daily basis. They don't need that in their lives, even if they're, 16, 21 years old, but my 12-year-old especially, or my 23-year-old, they have other things in their lives they need to deal with. They don't need to have constant updates about all of the things that I have to be updated with on a regular basis. So we try to make sure that, I can sit in the backyard, in a lawn chair around a fire pit, or I can sit out in the front yard and say hello to the neighbors and get that out of their life so that they don't have to deal with that. So I do that a lot. So anyway.
No, I think that it's good that you mentioned that, because we need to make sure that we're providing age-appropriate messaging to children.
Yes.
And even a 21-year-old, a 16-year-old, but certainly a 5 and 6-year-old need age-appropriate messaging and need to be comforted. And they're all watching us very carefully. So just making sure that we're reassuring them that it's going to be okay, but also providing facts when it's appropriate. But good move, Dad.
Yeah, we have a hard enough time making sure that our 21-year-old remembers to use the appropriate language around his 12-year-old sister. We have to do all of that. So, anyway, you are correct, Julie. Thank you. And thanks for continuing to remind me of all of that. So let's change the topic if we can. Could viewers continue to send in your questions and continue to send in your advice and questions. So here's one. First responders, they're dealing with stress in different ways than the rest of us. Any specific advice? There's Mr. Holt, he's back. Any specific advice for first responders?
While first responders are spending their time helping others, we also want to remind them to take care of themselves. And ADAMH is collaborating with OSU STAR program to provide support for Franklin County first responders during COVID-19 pandemic. We will provide information about the STAR live phone line on the scroll and the peer supports that are available to first responders. And they need to make sure that they get rest, exercise, eat, and everything that we're talking about doing on this show, they need to do as well. I was just on this morning with Lieutenant Parrish with the Columbus Fire Department, and we were talking about the challenges during these times, and the multiple runs, and the reruns to different places, and he realizes the stress is there, and they have a solid program to be able to provide support. But this is a particular program designed exclusively for first responders. So. And I know some of our provider agencies also work with first responders in different ways.
We do. Syntero does quite a bit of work with first responders. And I think, as this pandemic has emerged and we've seen more populations of folks being impacted, I'd like to also add, healthcare workers, obviously, mental health and substance abuse treatment experts and professionals who are on the front lines right now. So I'd like to make a pitch for those folks as well. And, teachers, administrators, there's just a whole new wave of folks that are being impacted by this. And I think we need to look at the culture of each one of those, those specific target populations. There's a whole different culture of, a law enforcement officer versus a healthcare worker. And so as professionals, we need to recognize the different needs and the different dynamics that are coming into play with this. Because, when you're the tough, helper, it's hard to ask for help. And there's going to be more and more folks who are going to need additional professional support as this continues to affect folks. So.
I agree, Julie. We had a power surge out here, but it's back on, I guess. So
Welcome back.
Yeah. I would just add that, like Commissioner said, those of us in leadership positions really need to pay close attention to this. We spend so much time taking care of others. We're taking care of our staff. We forget to take care of ourselves. 25 years ago, I had hair and I was probably 40 or 50 pounds lighter. And before you know it, you look around and you're like, oh my goodness, I'm stressed. I'm not taking care of myself. Your health, begins to struggle. People in your house see that you're struggling. And so I think just from that perspective, I think what COVID-19 has reminded us is that yes, we take care of others, but we also have to take care of ourselves. So we're there to actually help others as well.
Yeah. Well, there certainly are a distinction between different kinds of essential workers. Some of the folks that we could go through, and we did this a couple of weeks ago when I had a bunch of labor leaders on doing the same kind of conversation that I am with you guys. But one of the groups of the folks that we forget oftentimes are the grocery store workers.
Mm-hmm.
These are folks who are going to work every day, providing a service that we all need desperately. And these are folks who in many instances don't have health insurance, and a lot of them are living paycheck to paycheck. Where can these folks find some help, and what resources, if any, are available to them for free?
Well, all of our support hotlines and warm lines that we talked about earlier in the program are available for anyone who is in need of support. ADAMH helps to cover the cost of mental health and substance use care for those without insurance and any of our providers. So we make sure that folks, if they need care, can get care. And we're very, very fortunate in this community, in this county, to be able to offer the wide range of prevention, early intervention, treatment, and recovery support services for those within our community. And you'll find a full list of our providers at www.adamhfranklin.org. Again, that's www.adamhfranklin.org, and that should be on the scroll.
We're very fortunate to have the local levy that allows us to, all organizations, Syntero, Maryhaven, the whole All the other 30 organizations are able to provide services for folks who are unemployed, underemployed, have no insurance. And, so we're here. That's what the safety net is all about. And so that thankfully we're here for you if you need it. And that would include grocery store workers, baggers, anybody who works in the grocery store or anywhere else that does not have insurance or has limited insurance, we're here for you.
Great. We, a couple of weeks back, somebody suggested to us that we ought to do a resolution on behalf of essential employees and essential workers during this pandemic. And I was talking to Mark Fluharty from the AFL-CIO, and I said, Mark, we want to include the grocery store workers. And so we did a resolution covering all of the grocery store workers in Central Ohio, because at this point these are folks that are just putting their lives on the line every day. You think of folks that are when you think of folks like that, you think of police and fire, and these are folks, a lot of times teenage kids. They're putting their lives on the line every day for us. So important folks these days. So one thing that a lot of us are worried about these days, it's in the headlines all the time, are suicides, especially with the financial hardships, loneliness, and isolation. Suicides were already on the increase before the epidemic or the pandemic happened. If I'm not mistaken, over the past decade or so, they were on the increase. And so now, if I'm not mistaken, you guys know, you're the experts, but seems as though, from what I've been seeing and reading, they're on the rise even more so now.
Yes. Franklin County Coroner Dr. Ortiz reported in a press conference in February that during the time period between January 1st to February 21st of 2020 this year, the county saw a 40% increase in suicides and homicides compared to the same time frame in 2019. And that was before the effects of the pandemic had fully reached us. We will not know the full extent of COVID-19's impact on our community for many more months, because there is that lag there, and we have to be mindful of that. But this is the time right now is to reach out to, if someone is reaching out or asking for help, or if you start to see some signs and symptoms that someone is struggling, this is the very time that they need the support. And it's okay to intervene and ask hard questions and support them along the way. And I'm sure my colleagues may have some advice as well.
What I would just add, Kevin, there's still unfortunately a great deal of stigma related to mental health and substance abuse, if you will, especially in the minority communities. The more conversations we can have like we're having today, I think that helps. We have to tell people, especially males, it's okay to ask for help. It's not a sign of weakness. It's not a sign of all these things. We've got to be more vocal in terms of asking for help, because we're seeing these suicides. And we talked about this earlier. Commissioner talked about it. Is, man, if I would have known that, I've just reached out and said, hi, how you doing? And and it's just, and when you hear about it, it's so disheartening. But there's still a great deal of stigma. And so the more conversations we can have like this, the better, to bring that out.
I think one of the greatest tools that I know that Franklin County ADAMH Board funds in the schools is the Signs of Suicide program. And that teaches young people how to identify, concerns within their peers and to identify a trusted adult to go to. And it teaches them how to approach the situation and to go talk to a trusted adult with their concerns. And I think that's just such a powerful tool that our community, the Franklin County community and other communities around us, are providing to our young people to identify and know where to go for help and how to ask for help, and that it's okay. One other thing that I'd like to say, since I have the floor for a second, is that please, if you have firearms in your home, over 50% of suicides are a result of a firearm. So if you have a firearm in your home or firearms in your home, please make sure that they are locked up and away from anybody who is struggling at this point or any point.
Well, I know this topic has got so many, there's so much that we could talk about here. It comes along with a lot of questions. And so we're running short on time, and it's too bad because this is, we should have probably gotten to this topic earlier. So are there things that we may need to see or hear, and others, is there other signs, things that folks need to know, need to be looking for, on this particular topic?
Some of the warning signs that an individual may be having thoughts of suicide: increased use of alcohol or drugs, talking about feelings of hopelessness, having no purpose or not wanting or wanting to die, talking about being a burden to others, acting anxious or agitated, sleeping too little or too much, decreased concern about personal hygiene, and displaying extreme mood swings. And I know Julie talked about the signs of suicide, but there was also mental health first aid for youth that also communicate information. And I know that's expanding here in the county, and there are other avenues and speakers that can really help individuals who want more information to be able to obtain that information.
All right. If you sense that somebody's struggling and they're refusing to get help, is there something that friends or family can do?
Yeah, always get information and resources at the Franklin County Suicide Prevention Hotline. That number is 614-221-5445. Again, that's 614-221-5445, and that's the Franklin County Suicide Prevention Hotline.
So that number is, again, scrolling on the Facebook screen.
24/7, yes.
Good. All right. So again, really important topic. So I want to take the time before we're done to hear once again from Mr. Holt and from Julie Rinaldi separately. Do any of these warning signs change when we're talking about those that are fighting addiction, or when we're talking about children or teens?
First, I will say with substance abuse, no, they're the same warning signs. They pretty much go hand in hand, and just make sure you're vigilant, make sure you're asking questions, you're really concerned with the well-being of others around you.
I wouldn't say that there's a huge difference in children, other than that it's our responsibility as adults to really be hypervigilant and watching for the nuances in a child's behavior, and to look for the signs and symptoms in different ways. They may not be demonstrating them exactly like an adult would, but they're going to, have the same kind of symptoms, like lack of eating, lack of appetite, giving things away, giving up things that they love. So just kind of watching out for those nuances. And sometimes it's not so nuanced. Sometimes they're going to say, I won't be a burden to you anymore. You don't have to worry about me anymore, or for very much longer. So just, really being hyper vigilant right now. I know everybody's really busy, but it's important for us to pay attention to our young people right now.
Yeah. Well, as we're wrapping up here, there's one more stress that I want to talk about, and that's everybody being at home, either individually or together, for so long. There's no childcare for folks these days, and so the Governor DeWine announced that childcare centers are going to be open May 31st, but that doesn't mean that all the centers are going to be open. So, one, I want to talk about some of the tips that I have for families that are coping with being at home together, and then I want to ask you guys about it as well. Some of the things that we've been doing. We're a family of 6, all here together in this house for the last few months. We've been doing things together, getting out of the house together, going to metro parks, going on the trips together. We've been social distancing together at family. Just about every Sunday we go to my in-laws' house We all sit very, we space out in the driveway, in the garage. We take over our own utensils, we take over our own lights, we take over our own meals, but we go visit and sit and visit my in-laws and have a nice meal. It's just so we can spend some time with them. We go on trips separately as well. I'll take my daughter or my daughters, my sons, just to separate so that, we're getting out of the house and leaving so that we're not all together all the time. My son needs some space. He'll go for a drive, those type of things, making sure that we're getting time for ourselves and getting out of the house. My wife walks the dog more than the dog wants to be walked. My daughter gets exercise in her bedroom and does her yoga, but also goes for a walk every day. My other daughter goes for a bike ride with her girlfriend every day, socially distancing while they do it. And so we do all of these different things to make sure that everybody's getting time for themselves and time collectively together. We also have our own places in the house where we have our ability to spread out and have, my wife says we sort of have our own space. So we do all of those type of things to make sure that we're getting our own space and having our collective space. We have dinner together every night around the kitchen table as a family, as we always have done. So we're all here, but we're making the best of it. We also had a conversation early on where where tempers flared, and we got everybody together and we said, look, we're going to be here for a long time together. So we can't do this anymore. We have to make sure that everybody understands that before tempers flare up in the future, you need to stop, you need to think about it. You need to make sure everybody understands that we're going to be here for a while. So we need to handle these type of things differently. There's no more fights. There's no more arguments. There's no more blowing up at each other. So we do our best, but we had that conversation and it's been much better. So anyway, wanted to do that, but what advice do you guys then have for folks as they are living together, cohabitating, or living alone in this time?
Commissioner, it sounded like you were talking about my family. That's really good advice because we've gone through it. We had times where we can get away from each other, and at times when we're together, whether it's over a meal, whether it's going out and getting a pizza or supporting local businesses, is really vital. And coming from, I've been in Columbus for 34 years, came from the great state of Philadelphia, and as congested as Philadelphia is, these times can make you feel that way, but it's really important that you have time for yourself, but you have time collectively and you share those special moments because, it's a beautiful community, Franklin County's. I'm so glad we moved here. We've been so excited to have such a wonderful area to live in, but at the same time, we have to understand that during these times, we still have problems and they don't go away. So your advice sounded just like my family, to be honest with you, and just doing the fun things and getting away and sharing some time. So that's all I have to say. Thank you.
I would just say I agree with all of those things. Because Maryhaven's an essential service, I'm still going into the office every day. But what I will tell you, what we did is right before this happened, just by fate, we went out and got a mini golden doodle, brand new puppy. And that puppy has brought so much love and joy into this house. To the commissioner's point, I think we have forgotten to fight with each other because everyone's so busy doting over the puppy and taking walks and those kind of things. So, hey, if animals are wonderful for stress, they're wonderful for anxiety. If you don't have any family members around you, I would encourage you to go get some type of pet. And I am very partial to mini golden doodles. They're awesome dogs.
I just want to say that we've been talking a lot about the fact that we're all in the same storm, but we're not in the same boat. And so I'm just recognizing that, you know, not everybody that we're working with, and also our employees and the folks in the community and our clients, are not having the same experiences. And so just recognizing that not everybody has multiple bedrooms to escape to, or a yard to escape to. And so just trying to really look at, what do you have, what resources do you have, and how can we put a positive package together where you can feel like you're able to get away, or able to build some skills and get some relief during this time. So we're just trying to make sure we understand our employees, folks in our community, and our clients are not living in the same world that we are, or that we're describing sometimes. So
That's fantastic. Well, guys, I would tell you that my at the beginning of this, my daughter had given me a 23andMe kit, and I filled it out and found out that I'm 83% Irish. So I can fight with you even if I'm not. Well, so as we conclude, I would like to remind everybody that while all of those, all that information was scrolling on the website or on the Facebook page, you also remember to go to commissioners.franklincountyohio.gov/COVID-19. There's ADAMHfranklin.org, ADAMHfranklin.org/coronavirus-COVID-19 updates and resources. But all that information, again, was scrolled on Facebook. We'll continue hosting these commissioners' conversations, so keep watching for details. We always post the information on all of our social media channels: Facebook, Twitter, Instagram, and Nextdoor. So, of course, we want to reach as many of our residents as possible. So if you're talking to friends and neighbors, tell them we'll be streaming conversations like these on a regular basis and posting them on YouTube as well. So until next time, I'm John O'Grady, President of the Franklin County Board of Commissioners, along with Kevin Dixon. Kevin is the Vice President of Community and Cultural Exchange or Engagement at the Alcohol, Drug, and Mental Health Board of Franklin County. Shawn Holt, the CEO of Maryhaven, and Ms. Julie Erwin Rinaldi, the CEO of Syntero. So thank you guys for being with me tonight. Remember, we're all in this together, and we will see everybody on Thursday when we're with Matt Habash, the President and CEO of the Mid-Ohio Food Bank. Thanks, guys.
thank you.